The neurangate body, similar in its embryogenesis to other neural tissue, is a derivative of neuroectoderm. At about the 3rd week of gestation, after the zygote has implanted itself in the uterine wall in the form of a terophoblast, the definitive ectoderm is laid down between the endoderm and the pachyderm. The body somites, splanchnic mesoderm, and discordal plate invaginate into a pocket of dorsal mesenchyme and condense to form the spherical fibrous coat of the neurangate body, which is known as the rhindencephalon or the pila mater. The primitive neurangate body is sometimes called the zippity doodah. At birth, the neurangate is found to lie inferior to the kidney, where it is supplied with blood from the renal artery. By the 1st year of age, the body migrates superiorly to lie in its adult position in the foramen magnum, and has also changed arterial supply from the renal to penile arteries. Developmentally, the body may fail to ascend completely, resulting in anomalies such as neurangate axilla, peau d'orange, and Naranjatus oris occultus. Do you follow? A dissection of the mature neurangate body is now in order. We see the tough, fibrous rhindencephalon encasing the body, conferring a great deal of protective covering. Stripping away the coat, we expose the more delicate pila mater. A coronal section of the neurangate reveals the internal contents. In the center of the body, we find a very dense collection of axons known as the nucleus pulposus. The nucleus pulposus receives its axons from cell bodies in each neurangate lobe or section via the internal capsule, here seen in section as radial fibers leaving the nucleus pulposus. Reviewing diagrammatically, we have seen in coronal section the rhindencephalon, the pila mater, the neurangate lobes, the nucleus pulposus, and the internal capsule. Neurangate lobes number from 11 to 14 in quantity, a variable number due to the intrauterine environment of the embryo. High quantities of maternal ascorbic acid ingestion during pregnancy generally correlate positively with a greater number of lobes. A thorough knowledge of the name and location of each lobe is necessary. Each lobe is named according to a heliocentric orientation to the universe, with nucleus pulposus as sun, and dorsal lobes being the more distal planets, and ventral lobes the more proximal planets. Now we see Pluto, Neptune, Saturn, Jupiter, Mars, Venus, and Earth, and 3 others, Sleepy, Dopey, and Snow White. Sometimes a 12th lobe is found, and this is Uranus. Uranus may be found by taking a probe and... well, let's go on. Try it on yourself. Now, class, test yourself. Spin the neurangate body, and now locate all the lobes with their proper names. Which one is this? And how about this one? A horizontal section reveals the following contents. We see the longitudinal extent of the nucleus pulposus, fibers entering again from cell bodies in the lobes, exiting from the body via the head of the neurangate, or the guava. Also note the presence of the main nuclei of the lobes known as the ptamens. These bodies are secretory in function and exude CSF or citrate sticky fluid, which bathes and protects the cell bodies of the neurangate lobes. Reviewing again diagrammatically, note the rhinencephalon, the pila mater, the nucleus pulposus leaving the guava, and ptamens. The ptamens fuse with lobe cell nuclei to form the pileostriatum. Pathology. Often an adult neurangate body will malfunction and hyposecrete the CSF. In this case, donor neurangate bodies can be used to derive CSF and may be administered orally. Here we see a patient obviously suffering from hypocytremia, about to take his daily dosage of CSF. The beneficent effects of the drug are readily apparent.